So there was a question that came in regards to what do I do if I'm feeling faint or I feel like I'm having a heart attack? Starts the same way. Phone, 911, EMS, whatever way you can contact emergency medical services, not a friend or a relative at this point. You need EMS to get there, emergency medical services. So 911, leave the phone off the hook. If you're still conscious and able to talk to them, you could tell them, I'm having crushing chest pain, I'm feeling dizzy and short of breath, and I think I'm having a heart attack, and I feel like I might go unconscious. They will expedite fire, police, and ambulance to your location, priority one or high priority, lights and sirens, based on the fact that you have a life-threatening emergency. If they get there and it's nothing more than a panic attack or anxiety or it was something else, no problem. There's no issue with that, but it's better to be safe than sorry. So call emergency medical services right away, talk to them if you can, try to relax. If it is a heart attack, the American Heart Association guidelines are now instructing people that if you have aspirin and you don't have an allergy to aspirin, go ahead and chew it up. You don't even need to drink water. You can just pop the aspirin in your mouth. The acetylsalicylic acid is like, the best way to describe it without getting into too much detail is it's like a lubricant for blood platelets. And so it's not a blood thinner per se, it's more of a clot inhibitor. And so usually a heart attack is caused either from a blood clot or a fatty clot. But once that obstruction occurs, the blood stops flowing past that area, the blood starts to stick together and it can form even a worse clot. So even though the heart attack might be caused from a mostly plugged artery, it may not be fully occluded. So it'd be better if we did not do that. So taking the aspirin, chewing it, letting it absorb as soon as possible, if you're able to, even if you don't take aspirin on a regular basis, as long as there's some argument between whether it's, even if you're not supposed to take aspirin because you've got ulcers or I guess if you're going to have an anaphylactic reaction to aspirin, though I don't know if I've ever heard of anybody having that type. It could happen, okay? So I guess if you have a life-threatening disorder that's related to aspirin, then you wouldn't take aspirin. You just call EMS and hope for the best. But if you can take aspirin, that would be what you would do. Chew a couple baby aspirin or one regular strength aspirin, or I like to chew it and pulverize it because I think you're going to absorb it better once it gets into your intestine. Get yourself into a position of comfort and try to relax. I hope this helps. From Roy on Rescue, keep on rescuing. We'll talk to you soon. Bye-bye.